Benefits: GP visits and medicine. You may visit any doctor on the Ingwe Active Primary Care Network for doctor visits and acute medicine. Acute medicine includes medicine like antibiotics, where only a short course is prescribed by your GP to help you get better. Your network GP can prescribe medicine for you from a list of approved medicines called a formulary. Your GP will either dispense the medicine to you after your consultation or give you a prescription that you can take to a pharmacy to get your medicine. You can go to any pharmacy, but we suggest you go to a Dis-Chem, Clicks, Pick n Pay or MediRite pharmacy, as other pharmacies might charge an extra fee which you will have to pay. Remember that if you buy any other medicine over the counter which is not on your prescription, you would need to pay for it from your own pocket. Your network GP may also send you for a basic blood test and black and white x-rays. We will pay the account if the doctor is on the Ingwe Active Primary Care Network and if the blood tests or x-rays you have done are on the list that we cover. One of the reasons why Momentum Health's Ingwe option is preferred by students is that unlike similar options available in South Africa, it covers chest x-rays for student visa requirements. Go to www.ingwehealth.co.za for more information on how to obtain the radiology report and which radiologist to contact for your international student visa requirements. You do not need to consult an Ingwe Active Network doctor and can go straight to the radiologist. Chronic medicine. Chronic medicine is medicine that you need to take daily on an ongoing basis for conditions like asthma, diabetes and epilepsy. To view the full list of chronic conditions covered on your option, visit www.ingwehealth.co.za or call us on 0860 102 493. How should you register for the chronic medicine benefit? You will need to visit your Ingwe Active Primary Care Network doctor. If your GP diagnoses one of the covered chronic conditions, he or she would need to contact us. We will review the request from your GP and we will tell your GP if we need more information, such as blood test results, before we can confirm your benefit. If we approve the benefit, your GP will give you a prescription for chronic medicine according to an approved list of medicines. Where can you get your chronic medication from? You need to fax or email your prescription to Medipost Pharmacy and let them know where they must deliver your medication every month. You can refer to your member guide for Medipost contact information under the Chronic Medicine Benefit section. We can only pay for your chronic medicine if we have approved it and if your GP has prescribed it from the available list of medicines. You will need to get a new script from your network GP every 6 months and send it to Medipost. Specialist or physiotherapy visits. If you need to see a specialist, you must first visit your network GP, who will give you a referral letter and contact us on the number provided on your membership card to get authorization. You have cover for 2 specialists or physiotherapy visits per year, covered up to 1,000 Rand per visit and 2,000 Rand for the year. The benefit is covered at 100% of the Momentum Health rate. If the specialist charges more than this rate, you would need to pay for the shortfall from your own pocket. Dental visits. You may visit any dentist on the Ingwe Active Primary Care Dental Network. You have benefits for basic dentistry such as fillings, polishing and extraction of teeth. You have cover for 1 dental visit per year. The dentist will send the account to us for payment. If you need more than 4 fillings or 4 extractions, you need to contact us for pre-authorization. We will discuss more on pre-authorization later on in this presentation. Specialized dentistry, such as bridges and crowns, is not covered. If a specific dental procedure is not covered, the dentist will let you know and you will need to pay cash for it. Optical benefits, spectacles. You may visit any optometrist on the Ingwe Active Primary Care Optical Network. The optometrist will test your eyes and tell you if you need glasses. If your eye test shows a reading of more than 0.5, the optometrist will show you which frames you can choose from. If your eye test shows that you do not need glasses, a reading of 0.5 or less, the optometrist will send us the account for the visit only. You have cover for 1 eye test and get 1 pair of clear standard or bifocal lenses with a standard frame every 2 years. The optometrist will send the account to us for payment. We do not cover sunglasses, tinted lenses, and contact lenses. Emergencies and hospitalization. An accident can happen at any time, and it is important that you know who to call. So what must I do and who must I contact in an emergency, you may wonder. Look at the front of your membership card for the number that you will need to phone to get authorization for emergency medical treatment. If you're admitted to hospital, you must get authorization within 72 hours of admission. For emergency ambulance transport, call 082-911. Netcare 911 is Momentum Health's chosen service provider for medical emergency evacuation. Please note that you have benefits for one casualty or out-of-network GP visit per year, with a maximum of 2 visits per family per year. You pay the first 100 Rand of the visit. So let's take an example and say the doctor at casualty charges you 1,000 Rand for the visit. You will then have to pay 100 Rand and we will pay 900 Rand. In this example, we assume that the doctor charged the Momentum Health rate. If the fee is higher, you might need to pay more from your own pocket. You need to get authorization within 72 hours of your consultation, otherwise you will get to pay 30% of the account. Important: the casualty facilities at hospitals are separate facilities that aren't part of the hospital. So they may ask you to pay for the service and you would then need to claim it back from us. Under these circumstances, we will reimburse the account less the 100 Rand that was payable from your pocket. If you need to be admitted to hospital, you would need to call us for pre-authorization. If you don't get pre-authorization for hospitalization, you may need to pay 30% of all the claims relevant to the event, provided that the treatment you have qualified for authorization. Certain treatments may also have benefit limits, so please contact us if you are unsure. If you get an authorization number for a stay in hospital, the hospital will send the account to us for payment. The specialists who treat you in hospital will also be covered up to 100% of the Momentum Health rate